now let me discuss the sympatholytic drugs. So if you take this particular sympatholytics, the mechanism, if you see, these drugs, they act by blocking, right? They act by blocking alpha and beta receptors. So if you take the sympathetic drugs, they act via alpha and as well as beta adrenergic receptors. And if you take this particular sympatholytics, these drugs, they act by blocking this alpha and as well as beta adrenergic receptors. Alright. Now first let me discuss about the alpha blockers, and later on let me discuss about the beta blockers, and then we have both alpha plus beta blockers. So first let me discuss about the alpha blockers. If you see this particular alpha blockers, we classify the alpha blockers into non-selective alpha blockers and as well as the selective alpha blockers, right? So we have non-selective alpha blockers. Non-selective alpha blockers are those which block alpha 1 and as well as the alpha 2 receptors, right? Which block both alpha 1 and as well as alpha 2 receptors. Whereas if you take the selective alpha blockers, they selectively block, right? They selectively block either alpha 1 or alpha 2 receptors. They are the selective alpha blockers. So I'll discuss both of them. Let me discuss the non-selective blockers and let me discuss about the selective blockers. So first we have the non-selective alpha blockers. Right, we have non-selective alpha blockers. So if you take this particular non-selective alpha blockers, these are the one which can block both alpha 1 receptors and as well as alpha 2 receptors. Now this particular non-selective alpha blockers, again we classify them into irreversible antagonists and as well as reversible antagonists, in the sense those drugs which will block the alpha receptors irreversibly, they are irreversible antagonists, and those drugs which will block the alpha receptors reversibly, that is they are reversible blockers. Okay, so non-selective alpha blockers, if we take, like we have right, we have irreversible alpha antagonist, that is irreversible antagonist, and then we have reversible non-selective alpha blockers. You take irreversible antagonist. The irreversible antagonist, the example what we have, irreversible antagonist, that is your phenoxybenzamine, right? This phenoxybenzamine, it is a non-selective alpha blocker and it irreversibly blocks the alpha receptors, right? It's an irreversible antagonist to this alpha receptors, that is your phenoxybenzamine, which is an irreversible antagonist. Whereas you take this reversible non-selective alpha blockers. So if you take the reversible non-selective alpha blockers, the examples what we have is phentolamine and as well as tolazolene, right? So these are the drugs. So one we have phentolamine and the other drug is tolazolene. So these are the reversible non-selective alpha blockers, right? Now what are they doing? They are blocking the alpha receptors, in the sense whenever the adrenaline and noradrenaline acts on alpha receptors, the action of the adrenaline and noradrenaline will not be there. Why? Because the alpha receptors are occupied by this particular either phenoxybenzamine or phentolamine or tolazolene. Now, if you see here, you take alpha 1 receptors. If these alpha 1 receptors are stimulated, right, if alpha 1 receptors are stimulated, there will be vasoconstriction. Right, there will be vasoconstriction. Now what is happening? These particular drugs, they block the alpha receptors. So because of the blockade of the alpha receptors, instead of vasoconstriction, there will be vasodilatation. Okay, so remember a point here: blockade of alpha receptors result in vasodilatation. Right, result in vasodilatation. Now, because of this particular vasodilatation, the blood pressure of the individual may fall down. So that will result in what is called as postural hypotension. So remember, these drugs will cause postural hypotension. Now what is the criteria for the postural hypotension? In the sense, when the individual from supine position, right, if he turns his posture to standing, right, the individual from supine position, if the individual posture turns into a standing posture, then the blood pressure of the individual reduces. So how much this blood pressure of the individual reduces? The systolic blood pressure, it reduces by 20 millimeters of mercury. Diastolic blood pressure reduces by 10 millimeters of mercury. Right, systolic blood pressure reduces by 20 and diastolic blood pressure reduces by 10 millimeters of mercury. So remember, these agents, they result in vasodilatation and they will also cause postural hypotension. And why is this due to? This is due to antagonism of the vasoconstrictor alpha 1 receptors. So due to antagonism of vasoconstrictor alpha 1 receptors, they will cause vasodilatation and as well as postural hypotension. Alright, next. Now let me tell you, so this is the result. Now non-selective alpha blockers, they are blocking both alpha 1 receptors and as well as alpha 2 receptors. Now because of the blockade of alpha 1 receptors, there is vasodilatation and as well as postural hypotension. Now let me tell you what will happen if the alpha 2 receptors are blocked. You see here, whenever there is stimulation of the alpha 2 receptors, where are these alpha 2 receptors present? These alpha 2 receptors are present within the central nervous system. Whenever there is stimulation of the alpha 2 receptors, there is decrease in the sympathetic outflow. I'll repeat again. Whenever there is stimulation of the alpha 2 receptors, right? Whenever there is stimulation of the alpha 2 receptors, there is decrease in the sympathetic outflow. So a point what you should remember is alpha 2 receptor activation will result in decrease in the sympathetic discharge. Right, will result in decrease in the sympathetic discharge. And now, what is your non-selective alpha blockers doing? Non-selective alpha blockers are blocking this particular alpha 2 receptors. Now once this particular alpha 2 receptors are blocked, what will happen to the sympathetic discharge? The sympathetic discharge is increased. So remember, whenever these alpha 2 receptors are blocked, there is reflex increase, right? There is reflex increase in sympathetic discharge and as well as increased sympathetic outflow. So there is reflex increase in sympathetic discharge. Not only reflex increase in the sympathetic discharge, there is also increase in the, right, there is also increase in the sympathetic tone. Right, there is also increase in the sympathetic tone. Why? Due to blockade of the alpha 2 receptors. right? This is due to alpha 2 receptor blockade, right? This is due to alpha 2 receptor blockade. Now, because of increase in the sympathetic discharge, what will happen to the heart rate of the individual? Remember, because of increased sympathetic discharge, there is marked tachycardia, right? There is marked tachycardia. All right. So these drugs, what are they doing? Because of blockade of the alpha 1 receptors, there is vasodilatation. Because of the blockade of alpha 2 receptors, there is tachycardia. Now, let me revise once again. What I am doing is the sympatholytic drugs. The sympatholytic drugs are those drugs which act by both alpha and as well as beta adrenergic receptors. Now, among these alpha and beta adrenergic receptors, let me discuss about the alpha blockers. If you take these alpha blockers, we have two types, that is non-selective alpha blockers and as well as the selective alpha blockers. Non-selective alpha blockers are those which block both alpha 1 and as well as alpha 2 receptors. Selective alpha blockers are the one which will either block alpha 1 or the alpha 2 receptors. Now, among this, let me discuss initially about the non-selective alpha blockers. Non-selective alpha blockers, depending upon their action on the alpha blockade, they are classified into irreversible and as well as reversible. Irreversible alpha blockers are those which will block the alpha receptors irreversibly, whereas the reversible alpha blockers are those once the action of the drugs is reduced, the alpha blockade will be reversed. That is your reversible alpha blockers. Irreversible alpha blockers, example what we have is phenoxybenzamine, and reversible alpha blockers what we have is phentolamine and as well as tolazoline. And now let me tell you what will happen if alpha 1 receptors are blocked, and later let me tell you what will happen when alpha 2 receptors are blocked. When alpha 1 receptors are stimulated, there will be vasoconstriction. So whenever there is blockade of alpha 1 receptors, that will result in vasodilatation, which will cause postural hypotension. Whereas the alpha 2 receptors, once they are stimulated, there is decrease in the sympathetic discharge. So once these alpha 2 receptors are blocked, what will happen is there is reflex increase in the sympathetic discharge and as well as increase in the sympathetic tone. And because of reflex increase in the sympathetic discharge, there is marked tachycardia. So this is what will happen because of the non-selective alpha blockers. Now, with the usage of non-selective alpha blockers, right, with the usage of non-selective alpha blockers, there is a phenomenon which is called as vasomotor reversal of Dale. Now let me explain you what is this vasomotor, right? Vasomotor reversal of Dale. Now, when does this vasomotor reversal of Dale occurs? Whenever you are using this non-selective alpha blockers before adrenaline, that will result in the vasomotor reversal of Dale, right? So use of non-selective alpha blockers, right? Use of non-selective alpha blockers before adrenaline, right? Before adrenaline will cause vasomotor reversal of Dale. Alright. Now, let me explain you what do you mean by this vasomotor reversal of Dale. Before that, let me tell you what will happen if this adrenaline is given intravenously. Remember, intravenous injection of the adrenaline, right? Intravenous injection of the adrenaline, normally it will cause, right? Intravenous injection of the adrenaline, normally it causes increase in the blood pressure of the individual, right? Intravenous injection of the adrenaline, normally it causes increase in the blood pressure of the individual, that is alpha 1 receptor stimulation, right? And followed by that, right, followed by there will be a prolonged fall, right, followed by the prolonged fall. This particular prolonged fall is due to beta 2 receptor, beta 2 effect, right, that is beta 2 receptor stimulation. So if alpha 1 receptors are stimulated, there will be increase in the blood pressure, and if beta 2 receptors which are present within the blood vessels are stimulated, there will be fall in the blood pressure of the individual, there will be vasodilation. Alright, so with the adrenaline what will happen is, so there will be initial increase in the blood pressure of the individual, right, there will be initial increase in the blood pressure of the individual, and followed by that there will be a prolonged fall, followed by that there will be a prolonged fall. Now this particular initial increase is because of alpha 1 receptor stimulation, and you take the fall is because of the beta 2 receptor stimulation, right, fall is because of the beta 2 receptor stimulation. So this is what will happen normally if the adrenaline is given, right, if the adrenaline is given. Now you see a point here, if it is administered, right, which one, if the non-selective beta blockers are administered after giving alpha blockers, right, after giving alpha blockers, there will be only fall in the blood pressure which is seen, right. Let me tell you this. Now I am trying to explain you what do you mean by vasomotor reversal of Dale. What is this vasomotor reversal of Dale is, if the alpha blockers are administered prior to the adrenaline, right, so if alpha blockers are administered prior to administration of adrenaline, there will be only, right, there will be only fall in the blood pressure of the individual, there is no raise, there will be only fall in the blood pressure of the individual, and this is called as vasomotor reversal of Dale. Now why do you think that there will be only fall in the blood pressure if alpha blockers are given prior to the administration of adrenaline? See, what will happen here is, whenever you are giving this non-selective alpha blockers, right, whenever you are giving this non-selective alpha blockers, they block this alpha 1 receptors. Because they are blocking this alpha 1 receptors, there will be no increase in the blood pressure of the individual, there will be only fall in the blood pressure of the individual, right, there will be only fall in the blood pressure of the individual. So this will happen, right, when you are giving alpha blockers first, followed by that you are giving adrenaline. In this scenario you have this vasomotor, this is what is called as the vasomotor reversal of Dale. Right, vasomotor reversal of Dale. Alright, is that clear? Right. So this is the effect of the adrenaline on the blood pressure of the individual normally without giving alpha blockers. This is the effect of adrenaline on the blood pressure of the individual if they are given along with the non-selective alpha blockers. This is what is called as the vasomotor reversal of Dale. Now let me tell you the clinical uses of this non-selective alpha blockers. You take this phenoxybenzamine. Where is this phenoxybenzamine used? Remember, this particular phenoxybenzamine which is a non-selective blocker, is used to prevent the hypertensive episodes, right? This is used to prevent the hypertensive episodes during operative manipulation of the tumor in pheochromocytoma, right? So this is used to prevent used to prevent the hypertensive episodes, right? Remember, this phenoxybenzamine is used to prevent the hypertensive episodes during operative manipulation of tumor in pheochromocytoma, right? During operative manipulation of tumor in pheochromocytoma. Now, what is this pheochromocytoma? Pheochromocytoma, it is a tumor. It's a tumor which is originating from the chromaffin cells of the adrenal medulla. This particular pheochromocytoma, it will produce excess amount of norepinephrine and as well as epinephrine. Right? It will produce excess amount of norepinephrine and as well as epinephrine. What is the treatment of choice for pheochromocytoma? Is the surgical resection of the tumor. That is the treatment of choice for pheochromocytoma. Now, whenever you are manipulating the tumor to remove, that is your pheochromocytoma, there may be chances of hypertensive episodes due to spillage of epinephrine and norepinephrine into the plasma. So, to prevent that hypertensive episodes during operative manipulation of the tumor in pheochromocytoma, we use this phenoxybenzamine. Next, then we have reversible alpha blockers, reversible non-selective alpha blockers, that is phentolamine and as well as tolazoline. Where are they used? Let me tell you. So, if you take phentolamine, right, phentolamine and as well as tolazoline. Remember, the phentolamine and as well as the tolazoline, they are preferred agents for the treatment of the hypertensive crisis in clonidine withdrawal and as well as in Cheese reaction, right? So, this is the treatment of choice for hypertensive crisis in patients with clonidine withdrawal, right, in patients with the clonidine withdrawal and Cheese reaction. So in these two clinical conditions, there is chance of hypertensive crisis. So for this particular hypertensive crisis, the drugs which are required is the phentolamine and as well as tolazoline. Alright, so these are the preferred agents. So let me revise. With the usage of non-selective alpha blockers, prior to the administration of adrenaline, there is fall in the blood pressure of the individual, and that phenomenon is called as vasomotor reversal of Dale. Why that vasomotor reversal of Dale? What exactly is that? In a normal individual, if you give adrenaline, initially there is rise in the blood pressure of the individual followed by prolonged fall in the blood pressure of the individual. The initial rise of the blood pressure is because of alpha 1 receptor stimulation, followed by this prolonged fall is due to beta 2 receptor stimulation. But whenever you are giving non-selective alpha blockers prior to adrenaline, there is only prolonged fall in the blood pressure of the individual, and that particular prolonged fall of the blood pressure of the individual with no rise in the blood pressure is called as the vasomotor reversal of Dale. Next, you take the irreversible blockers phenoxybenzamine. Clinically, where do we use this? It is used to prevent the hypertensive episodes during operative manipulation of the tumor in pheochromocytoma. And you take phentolamine and as well as tolazoline, they are used in hypertensive crisis in conditions of clonidine withdrawal and as well as Cheese reaction. Now let me tell you, or let me discuss the selective alpha 1 blockers. So until now what we have discussed is the non-selective alpha blockers. Now let me discuss the selective alpha 1 blockers.